Should we get started? What do you think, Sean and
Do it.
Yes, please.
right. Okay. Welcome all. Welcome all. Thank you for coming to Ribbon's webinar today. I'm going to bring greetings from the team Ribbon. So I bring greetings from myself, Shauna Cooper, who is Ribbon's program director, as well as Heather O'Connor, Ribbon's communication specialist. I want to welcome you to the ROC policy update and advocacy on efforts for HIV and aging inclusive care and prevention. I am a firm believer that we should know our rights. When we don't know our rights, we are at the mercy of someone else. Therefore, we have a responsibility to learn more about our rights, how to exercise our rights, and what to do when our rights are violated. I think that this presentation that our colleagues at SAGE, Terry Wilder and Aaron Tax are going to present to us today is really timely, especially in light of Braidwood management case, the case where a group of Christian business managers were basically affirmed by the court to be able to mandate what they will pay under their health insurance. And as you may know, one of the things that they no longer have to pay for is PrEP. And they said that them having to distribute PrEP, an HIV prevention method, was a violation of their religious freedoms. So we are now, we continue to play this dance between what individual rights, societal rights, and even the rights of other individuals in light of exercising other rights, people exercising those types of rights. So we need this Bill of Rights that Terry and Aaron are going to talk about today. And we need to also learn about the other ones. The biggest ones, the United States Constitution with the Bill of Rights. If you have not read that yet, in light of what's going on in our political system and in this government, please at least take a look at that and see what your rights are. So with that said, I am going to present Terry. And Terry is a member of ROC, Ribbon's Organizing Center. She's actually a member of our policy action group, and she sits there as a representative of SAGE, which is a Gilead HIV/AIDS positively grantee. And in her capacity today, she is representing SAGE as their HIV aging and policy advocate. Terry has over 25 years of experience in social services, public health, communications, and project management, and has a whole host of healthcare focuses that she's interested in, such as HIV care and prevention, hepatitis, sexual health, LGBTQ health, COVID, because it's not over yet, everybody, even though we want to pretend. And I'll let her continue with all the range, all the things that she is very much interested in. If you want to know more about her, she's on LinkedIn. I thought you can find her on there. So Terry, I want you to introduce Aaron, and then you and Aaron to go into your presentation. Thank you for being here with us today.
Great. Thank you so much, Vanessa. I appreciate the invitation for both Aaron and I to be here. Aaron Tax, first of all, is my boss.
Oh, hi, Aaron.
So there's that. So be kind, be very kind. And let me pull up my screen so I can do a proper.
And while you're doing that, Terry, let me inform all of you who are present with us today. Let me start at the very beginning rather than give this to you at the end. These are the rules of engagement. Terry and Aaron will do the presentation all the way through. If you have questions and comments, we will take them at the end. Make sure you put them in chat so you don't forget or write them down. Thank you. Go ahead, Terry.
All right. Everybody can see my screen. We're all good there.
Yes, we can see it.
All right, thank you so much. So let me finish introducing Aaron. So in addition to being my boss, he is the Managing Director of Government Affairs and Policy Advocacy. He's been at SAGE many, many years. He is a lawyer by training. And you'll hear from Aaron shortly, but I'm going to kick us off here. So our topic today is really to talk about policy updates and advocacy efforts for HIV and aging, inclusive care and prevention. And as Vanessa stated, Aaron and I both work at SAGE. If you're unfamiliar with SAGE, I'll just give you a quick explanation as to who we are. So we are the world's largest and oldest organization dedicated to improving the lives of LGBTQ plus older people. We were founded in 1978 and we're headquartered in New York City. We are a national organization and we offer supportive services and consumer resources for LGBTQ plus older adults and their caregivers. And that also includes people with HIV. Aaron and I are focused on policy advocacy. And so SAGE advocates for policy changes every day that address the needs of LGBTQ plus elders, including people with HIV. We provide education and technical assistance for aging providers and LGBTQ plus community organizations through our National Resource Center on LGBTQ plus aging, which you can find on our website. And we do a lot of cultural competency training through our SAGE Care program. You can learn more about us if you go to sageusa.org. So what we're going to be talking about today is efforts to pass an LGBTQ plus and HIV long-term care bill of rights across the United States. We're also going to talk about advocacy around the Older Americans Act to be more inclusive of HIV. And we're going to end our conversation today by talking about efforts to remove the upper age limit of the HIV testing Centers for Disease Control and Prevention guidance. So you'll learn about the importance of these policy changes and improving the quality of care for older adults living with or vulnerable to HIV, and how you can support and become involved in these advocacy efforts. So just to start, I'm sure many of you know this statistic. I see my friend Ronald and Linda here today. But just to start foundationally, over 50% of people living with HIV in the United States are over 50 and older. And by 2030, it's estimated that over 70% of people living with HIV will be 50 and older. So, you know, keeping that in mind, we started to think about, you know, where do people age? Well, I think probably the majority of us want to age in our communities, in our home, but that's not always possible for some of the folks in our community, our friends or family member. So thinking about an LGBT and HIV long-term care bill of rights is really important, because if people end up having to age in a long-term care facility, we want a bill of rights that protects them from discrimination on the basis of their sexual orientation, gender identity, and HIV status. Many of these bill of rights would be something that could update a state or municipality elder law or another kind of human rights law. It's also something that would mandate LGBTQ plus and HIV cultural competency training for staff. So an example of how a long-term care bill of rights like this might protect folks that we care about in our community is that it would make it illegal for a long-term care facility to deny admission to a person based on their sexual orientation, gender identity, or HIV status. Some folks may think, you know, that never happens anymore. It's 2023. Well, folks may remember just a couple of years ago, Pause Magazine had a story about a family in which they experienced discrimination. So this is Courtney, and I'm probably saying the last name incorrectly, but I believe it's Sheilor. So Courtney was looking for a nursing home in Nebraska for her father, John, who's in the picture with her, and 6 facilities refused to accept him because he was living with HIV, she says. And so he was in his late 50s, was starting to have some early signs of dementia, and really needed that 24-hour, 7-day-a-week skilled nursing care.
There was a rebound. And
So,
this rebound,
Excuse me, we ask that everyone please mute your
However,
mic so that we can give the speakers our undivided attention. Thank you. Please continue, Terry.
thank you. So, the American Civil Liberties Union got involved in this case of discrimination. And so writing on behalf of her and her father, they sent letters to nursing homes warning them about the potential consequences of their actions and offering them solutions on how to rectify this, because this was discrimination based on her father living with HIV. So this does happen, which is one of the reasons why we were so grateful to have this conversation today. So, some people may again think, many states have these kind of protections. So why is it important to have a very specific LGBTQ plus and HIV long-term care Bill of Rights? Well, when we think about our community, older adults who identify as LGBTQ plus or living with HIV, what we're finding is that they're more likely to rely on institutionalized settings for care because they lack adult children or other family members who can provide that informal caregiving. The other reason is HIV stigma and discrimination is real. And there are documented problems in long-term care facilities. Additionally, staff that work at the facilities are not always clear on how to provide respectful and appropriate care to residents with HIV. And it's clear that if we have these kind of Bill of Rights, it not only protects people, but it also is a really powerful tool for self-advocacy that the actual person could use if they are experiencing discrimination or stigma in the facility that they're living. They can point to this Bill of Rights as a tool to say, you can't treat me this way. There's a Bill of Rights. So there are a number of these Bill of Rights already across the country. So California has one as a state, San Francisco has one as a city, Washington, D.C. has one, Montgomery County in Maryland has one. New Jersey was the last state to pass a Bill of Rights in their state, and New York State is currently working on one. So we're hoping to get very close during this legislative session to pass. The SAGE has done a lot of work around this. We also have a toolkit. So if folks are interested in pursuing this in their own state, I encourage you to go to our website. Here is the link. You might want to pull out your camera and take a picture of it. But you can also just Google SAGE LGBTQ plus and HIV long-term care Bill of Rights toolkit, and it should come up. So this is a nice guidance to kind of take you through some of the key pieces here. If you were interested in gathering in your own community to start working on this together, we at SAGE, of course, are also here to help with technical assistance and talk with you through the best way to do that for the state that you live in. But of course, it's important for folks in the individual states or communities to really take the lead on this so that it's really appropriate for the community that you live in. So I'm going to turn it over to my colleague, Aaron, who's going to talk about the Older Americans Act.
All right, thanks very much, Terry. So as Terry said, I'm going to talk about the Older Americans Act, known as the OAA, which people do not pronounce as OA, just OAA. So more on the OAA. You see President Lyndon Johnson here. He was president when the Older Americans Act became law back in 1965 as part of his Great Society. And the idea behind the Older Americans Act is it's kind of like a counterpart to Social Security and Medicare, with Medicare covering ostensibly covering people's medical needs. The idea behind Social Security is to cover your financial needs, and the Older Americans Act is everything else that should enable you to age in place. As Terry said, that's what most people want to do. You don't want to, most people say, are not saying, sir, I want to move to a decrepit institution. They want to age at home where they are comfortable. So next slide. So what does the OAA do? It's one of those things that I think everyone's probably heard of what it funds, but they never heard of the OAA itself. The most famous program the OAA funds is Meals on Wheels, and it's a great example of what the Older Americans Act does. Again, the whole MO behind the OAA is to enable people to age in place in their communities. So what exactly does the Older Americans Act fund? It funds home and congregate meals, so meals in senior centers, and home delivered meals like Meals on Wheels, chore assistance, transportation assistance, legal assistance, falls prevention, caregiver support, health promotion, all sorts of things, again, that enable people to age in place. The way it is funded, or the way it's structured, is money flows from the Administration for Community Living, which is kind of like our federal Department of Aging and Disability. They in turn fund the 56 state units on aging, which are basically state departments of aging, like the California Department of Aging or the New York State Office for the Aging, NYSOFA, so on and so forth. And they in turn fund the over 600 area agencies on aging. So these are, generally speaking, county departments of aging. They also could be nonprofits. So New York City, it is New York City Aging, formerly known as DFTA, Department for the Aging. If you live in Montgomery County, Maryland, it's probably the Montgomery County Department of Aging or something equivalent. That's kind of just the AAAs. They in turn fund 20-something thousand service providers. And SAGE in New York City is a good example of a service provider. We run about a half dozen LGBT targeted senior centers. So we are a beneficiary of money from the AAA as well as from the State Unit on Aging. And we're one of those 20-something thousand service providers across the country, in part using OAA money to fund the work that we do. If you're getting a home delivered meal, I might be wrong on the exact number, but maybe if it costs $7, maybe $1 of it is federal money. So the way it works is there's the federal money, it's about $2 billion a year. And then it kind of snowballs or becomes bigger because the state trips in, the area agencies on aging, so on and so forth, the counties and whatnot chip in. So it leverages, they all leverage the money from the federal level to provide those services and supports at the local level. So next slide. We covered a little bit of this stuff, but these are types of things that state units on aging and area agencies on aging covers. You got some elder rights prevention, caregiver support, promotion of health and wellness. It doesn't cover healthcare per se, but it's promoting health and wellness, again, with the idea that we want people to be empowered to age in place in their community. And you see here on the right, supportive services. So some help with some chores, some help with transportation, some help with modification in case management, so on and so forth. Next slide. So why do we're not anti-LGBT at SAGE, so that would be entertaining. So the rationale behind this slide is it signifies what happened when the law, when the Older Americans Act was updated or reauthorized in 2020. And we are trying very hard to get some targeting language in the law with respect to LGBT folks and those living with HIV. And unfortunately, the HIV targeting language fell out rather early in the game. And I'll be candid, the opposition we got was from many groups who said, well, we're concerned if we make older people living with HIV a target population, then won't every other group that represents people with various diseases also want that designation for the people they represent? And as you can imagine, older people have more comorbidities and more health challenges than younger people, generally speaking. So they were worried it would be kind of like the exception or the targeting that swallows the whole rule, like everyone would be targeted and it would be meaningless. So that was the pushback that we got on HIV. I think, we could argue, in part based on what Terry shared earlier, the unique history of stigma and discrimination and challenges that older people with HIV have. But nonetheless, that fell out early in the game. What we were left with is advocating for LGBT folks. And we ran up against the folks in control of the Senate at the time who did not support LGBT rights. And they said, we will not allow any legislation to move forward that explicitly mentions LGBT people. So we had to try to find a workaround or get nothing at all. So next slide. So today we ended up incorporating LGBT folks by reference to another document. The good news is that at the end of the day, we got some really good language in there. So at the end of the day, every single one of those state units aging and every one of those area agencies on aging must do 3 things. And you see that on the left side of your screen here. Engage in outreach to LGBT older people, collect data on their needs, and collect data on whether you are meeting their needs. So again, engage in outreach to LGBT folks, collect data on their needs and whether they're meeting their needs. It's now federal law. So whether you're the Texas Department of Aging or the Mississippi Department of Aging or the Biloxi Department of Aging, or the Waco Department of Aging, you have to do these 3 things. So that's kind of cool. And on the right, you can see where that language is found in the Older Americans Act itself. Next slide. In addition to being in the statutory language, ACL, the agency I referenced earlier, the kind of Federal Department of Aging and Disability, it stands for the Administration for Community Living, came out with some guidance in which they say they themselves, and this is under the Biden administration, believe that LGBT folks and those living with HIV are in fact populations of greatest social need. So it doesn't have the force of law, it has, I guess you could say, the force of suggestion or encouragement, and that is guidance that came out from ACL. All right, next slide. So what are opportunities, to engage in this work? So some background here. If you can imagine something gets written into the law, there might be well-meaning state units on aging or AAAs who read the Older Americans Act reauthorization, if they were by chance to read all, many hundred pages of it. And if you did that, you wouldn't even notice the LGBT folks are referenced because, as I mentioned earlier, we are written out of the law. So part of our work right now is to educate all those state units on aging and all those AAAs about the language itself, because some of them might be well-meaning, might not be homophobic or transphobic, but might not even realize the language is in there. So we need to make sure they understand the language is in there and what their obligations are. And then, there might be some folks who are haters and you have to tell them about it. And we have to, reinforce that this is the law. This is something that they have to do. And then, we have to do the same for all those area agencies on aging, over 600 of them across the country. So we have our work cut out for us, and we are engaging with our list of activists, our action squad, to help educate those state units on aging and those AAAs. So if you're interested in learning more, go into SAGE's webpage at sageusa.org. You can join our action squad. And then on the left-hand side, you can see some information we put together on this work that we're doing. We have explanation sheets or explanatory sheets for state units on aging, for AAAs, about what the language is and where they can find it. And yeah, if you want to kind of stay ahead of the game on the next reauthorization of the Older Americans Act, which is up next year, it's going to be the next big update. You can get on our list here. The other thing I should mention is the Older Americans Act is going through the first updates to its regulations since 1988. That's been a long time. And we are pushing there for explicit non-discrimination language, for cultural training, for an explicit greatest social need designation, all sorts of good stuff. So one thing we'll share with our action squad list are opportunities to weigh in as that comment period, or multiple comment periods, really move forward on the regulatory process. I don't know if I'm speaking on the next slide. Let's see. I might be done. All right, I'm done. Back to Terry.
Thanks, Aaron. So, I started at SAGE last July, and, my whole focus, like I mentioned earlier, is focusing on HIV and aging. And while a lot of our policy advocacy work is around supporting and fighting for the rights of people who are aging with HIV, we're also very concerned about HIV prevention. So I want to kind of end our time formally talking with you before we go into discussion and question, talking about a current U.S. Centers for Disease Control and Prevention guidance. And that is their guidance around HIV testing. We strongly believe at SAGE that the CDC should remove the upper recommended age limit for HIV testing. Right now, the CDC's HIV testing guidelines state that in all healthcare settings, screening for HIV infection should be performed routinely for all patients aged 13 to 64. There's some problems with this, obviously, because we know that folks can acquire HIV certainly after 64. And so if the guideline is very specific within that particular age range, it may give permission to providers to not even think about offering HIV testing to folks who are older than that age. So our goal is to have that upper age limit removed. So it could say something like this: in all healthcare settings, screening for HIV should be performed routinely for all patients aged 13 years and older. And I should mention that, you know, kind of a model for this at the state level that could be adopted at the federal level is what New York State did many years ago. In New York State, there's an HIV testing law that was implemented for medical providers to offer HIV testing to folks 13 to 64. Several years ago, folks came back with the very same rationale. You know, folks older than those age should be offered HIV. We know that folks you know, who are getting diagnosed late because nobody's thinking about this particular age community. And they amended that HIV testing law, which now says to offer HIV testing to people 13 and older. So we appreciate New York State's leadership in that, and we'd love to see that happen federally. So, you know, what are some other reasons why this is needed? Well, one reason is many older adults and their providers don't think that older people are at risk for HIV. And the other reason, which, you know, a lot of times when we're advocating for things, data really helps us make our point. And in 2020, approximately 17% of new HIV diagnoses in the United States occurred among people age 50 and older. That is not an insignificant percentage. So let me show you. So this is a screenshot. I literally went to the CDC website and pulled their chart. So this is their new diagnoses in the US independent areas by age at diagnosis in 2020. So if I can just draw your eyes down to kind of the bottom of the chart, you'll see 50 to 54, there's 1,883 people diagnosed. Between the ages of 55 and 59, there were 1,599 people diagnosed. 60 to 64, there was 901, and 65 and older, there was 702. Now, here's something that's really important about this data. There is a kind of disclaimer that is attached to this data. So data for 2020 should be interpreted with caution due to the impact of the COVID-19 pandemic on access to HIV testing, care-related services, and case surveillance activities in state and local jurisdictions. So I know when I spoke to my friends, you know, during kind of the major height of the pandemic, people were not able to offer HIV testing. People weren't able to go out to health fairs. They weren't able to go to the different places in their community where they offered HIV testing. Also, people weren't able to come into their primary care providers unless it was an emergency. So my guess is that these numbers from 2020 are actually lower than what they really are because people didn't have access to testing. So it'll be interesting to see when the CDC releases their data for other years to see if that actually goes up once the data hopefully gets corrected. So, you know, when we're thinking about like, how does this happen? How do we advocate for this upper age limit to be removed? It's up to the CDC and the US Preventative Task Force to change their recommendations and guidelines. So how do we influence this as activists and advocates? What do we need to do to accomplish getting this removed? Well, as we know, speaking up truth to power, pressure from advocacy organizations, aid service organizations, other organizations that care about our community is the best way. Taking every opportunity to speak up in meetings about this, especially when you know that CDC representatives are going to be in the room. So meeting with the CDC leadership. So SAGE has had meetings with CDC leadership and discussed this with them. We've also given public comment. This past week, there was a CDC HRSA meeting. I gave public comment and brought this up. If there's opportunities to give public comment through the U.S. Preventative Task Force, opportunities to give comment at PACHA, the Presidential AIDS Advisory Council. I gave PACHA testimony recently. Any opportunity to kind of raise this up and start talking about it and getting it more and more elevated is going to help us to be able to move this so that this change happens. So, there's some other additional measures that can be taken to advance HIV testing among older adults. So the CDC and sister agencies should dedicate resources to developing and evaluating HIV prevention campaigns and interventions that target older people age 50 and older. When I lived in New York State, there was this great campaign by ACREA, Age is Not a Condom, that really, got people's attention. It would be great to have an equally thought out campaign that was nationally. The other thing is these campaigns must encourage the use of PrEP and PEP.
And it could be formal connection through an EMR.
Can you please mute your mic?
Would often do.
We're getting some background noise. Thank you.
These campaigns must encourage the use of PrEP and PEP among older women and men. There's a lot of great campaigns that are happening. I just went to the Biomedical Prevention Conference in Las Vegas. There's a lot of great work being done at the local level, but at the national level, you just don't really see it that much, and really pushing for that to be part of any campaigns. HRSA should encourage Ryan White recipients to use HIV testing resources to specifically target older adults by ensuring that the planning councils include such testing as priority, and that contracts are secured with the organizations that are most able to reach the community. And the CDC's and its partners agencies should increase collaboration across HIV service testing networks, the Aging Network, and faith-based community organizations to improve HIV testing rates among older adults. And then finally, the CDC would support an involvement of the community, which I think we all know is critical, but anything like this must be planned with the community. They should really develop and disseminate HIV testing, prevention, PrEP, PEP, social messaging, and marketing campaigns to older adults who are most vulnerable to HIV. So we'd love for you to stay in touch. Again, here's our website, sageusa.org. There's lots of materials, lots of ways to connect with us. And, please reach out to me and Erin if you want to get involved or you want to brainstorm ways to work together in your own community around any of the things that we talked about the Long-Term Care Bill of Rights, the Older Americans Act. There's opportunities at your state to influence the state aging plans, and certainly welcome any collaboration or thoughts around the advocacy work to get the CDC to remove that upper age limit. So I'm going to stop here so we have time for discussion and questions.
Thank you so much, Terry and Erin. That was a powerful presentation about rights, why we need to know them, how we can protect them, and where we can go to ensure the laws are properly enforced, or where we can go to ensure that we create laws that will protect us. So I want to thank you both for doing that. Before we get into a discussion, And we're going to ask folks who want to have questions or comments to raise their hand. And Heather and Shauna, let me know because I can't see everybody. Okay, if there's folks who want to ask questions who have their hands up, but I can't see it. But before I do, I want to ask if Linda is my colleague and partner at Ribbon. She serves as the co-executive director there. And I noticed she's on the line. And Stephen, I'll come to you, Stephen Vargas, and Terry Taylor. I will come to you both if Linda is on the line and wants to say something.
Just saying good afternoon, everyone, and I'll pass it off to Terry because she had a question in the chat.
Okay. All right, Miss Terry. Terry, I actually have someone before you, Terry, and I'm going to give them that first, and I'll come to you, and then I'll come to Stephen. Is that okay with you? Okay, good. I hear you. I think I see it. So Stephen says, the incidence of HIV among those over 65 in 2020 was tenfold of that of the 13 to 14-year-olds, and the disparity would have been greater, but that those over 65 are using all public services, much less than younger folks. What do you think about Stephen's comment? If you'd like to comment on that at all.
Yeah, I mean, I think this just, reinforces why we really need to push for this HIV testing age limit being removed. I mean, I think my biggest concern, to be honest with you, is that I'm scared that people don't know that they have HIV, so they don't get connected. And then when they do find out they have advanced disease, and I get really nervous. So I should tell you, I'm a social worker by training. So I've been a case manager, inpatient, outpatient HIV clinics, and I just am nervous about if we aren't offering these tests so that if people do have HIV, we can connect them to care. It just scares me, about that people could get so sick or that they could die. And for many of us who lived through the 80s and 90s, I want people to have every advantage possible to take advantage of all the scientific advances and all of these beautiful resources in our community that so many people fought for so that they can live happy, healthy lives. And I think, by not lifting this upper age limit, we're putting people at risk for death.
I agree. And it just reminds me because HIV impacts everybody across the lifespan. And so what we need is a lifespan rule that no matter where you are in your stage of life, you have access to an HIV test. But so many people, because either their ignorance or bias, or maybe even because they're dealing with insurance companies that won't cover it, although I believe that's not true anymore, we're just still losing a lot of people, even those under 50 and more so are over 50. So I'm going to turn it over to Terry, and then I know that Stephen Vargas had his hand up. Terry, go ahead.
Good afternoon, and thank you guys for being here presenting this information. So what are the highlights of the LGBTQ plus and HIV long-term care Bill of Rights? And is there a federal bill number that goes with that?
So I'm going to let Aaron take the federal part of this because he's been working on that part. But kind of the highlights on this Bill of Rights is that it protects people from discrimination when they're living in a facility. It protects them from discrimination in terms of denial of admission. And then the third part is that it requires staff to be trained on LGBTQ plus cultural humility as well on HIV, because believe it or not, I know this crowd knows 2023, people still don't know the basics of HIV, even in healthcare. So Aaron, can you talk about kind of the work that's being done to try to have something like this at the federal level?
Sure. So we're pushing this on two fronts, administratively and legislatively. So administratively, if any of you saw the Pride executive order that President Biden put out last summer, he committed to his administration advancing an administrative long-term care bill of rights, which of course would not necessitate something going through Congress. So these days it could actually get done. The second thing we're working on is a legislative version of this, and we're still in the drafting stage. We have a good start, and we're working on continuing to draft it and tweak it and shop it around the Hill. So I hope we'll have an introduction sometime this year. You know, realistically, it's not getting out of this House of Representatives because I wouldn't say they stand for equality, so it really won't move anywhere this year, but it's still a good marker for the future. And, you know, if the composition of Congress changes, we have an introduction, it'll put us in a better spot in the future.
You're going to have us holding our heads in a minute, Aaron. That's a heavy lift. I get it. I understand.
Yeah.
That emotion was coming through like, oh boy, this is going to be a struggle. And it is. And so in light of that, Aaron, I really want you to talk to us about what the participants can do or the attendees can do to help SAGE.
Oops, take myself off mute. Is if you're interested in activism around any of these things, you could always join our action squad. I'm going to see if I can find a link for that. So that's where we're going to push out information on the rulemaking on the Older Americans Act, or if we do other, you know, campaigns to reach out to members of Congress and whatnot. So let me find that. That's kind of the main thing I could think of.
What about stories for people? Because folks, I know Terry
Yes.
at one time, and Terry can speak to that too.
Yeah.
Absolutely. Yeah.
So, you know, SAGE, because of our long history, you know, dating back to 1978, we have a lot of relationships, and we often have people reach out to us to ask us to convene spaces for government officials to hear the stories of people with lived experience. So, for example, recently, Health and Human Services reached out to us because they wanted to have a conversation with us about these concerns around HIV testing, but also STI testing, PEP and PrEP access with older adults. And so, you know, I reached out to Vanessa and Linda to ask if they knew of any folks that would be willing to speak from lived experience, whether they are a person living with HIV that were concurrently diagnosed with AIDS because they were never offered an HIV test, people who have never ever had their medical provider even have a conversation with about their sexual health, to show that, like, this isn't just Terry and Aaron just talking about this because we're just concerned about it because it's you know, something we came up for our policy agenda, that this really is impacting the real lives of people in our community, our friends, our family members. So, you know, we were able to have a really great conversation with HHS a couple of years ago about this, and have people who not only worked as peer workers, who do testing and STI screenings in their communities and offer PEP and PrEP, but we also had, you know, an older adult who was concurrently diagnosed with HIV and AIDS because for like 5 or 6 years going to a doctor to try to figure out what was wrong with their body, nobody ever offered them an HIV test. It's bananas.
Yeah.
And so, you know, we have these opportunities presented to us a lot of times. And so I put my email in the chat. You know, please reach out to me. I'd love to have, you know, a conversation with you all if you're interested in being considered in the future, because we always have these opportunities presented to us about gathering the community so that, you know, people in power who make these changes can hear stories of real people in the community. So please don't hesitate to reach out to me because, you know, I want them to hear from you. I can talk, but it's not as powerful. It's certainly more powerful from people with lived experience.
Thank you both. I want, before we go to Stephen and Ronald, I see your hand and I will get to you. I wanted to let everyone know there'll be an evaluation. The link will be put in chat. Please give us your feedback. It is really helpful. And it also lets our presenters know how well they did. Everybody likes to be graded. I don't know why, but Aaron's like, no, not everybody. But anyway, please do the evaluation for us. Stephen, if you are still on the line with us, if you want to come off of mute and share what you wanted to say, in terms of a question or comment, you're more than welcome to.
Thanks, Vanessa. It's good to see you. Good to see you, and good to see Terry and Aaron again too. Hey, right now, planning councils a lot of them are in their process of how to best meet the needs of their community. So if y'all have any specific recommendations that folks could hear right now, they might be able to bring it up in their meetings and try to get some changes done at their local levels, the ones that are applying to their local levels, essentially. And so we have a few already here that we're thinking of in Houston, but whatever y'all have to share, I'm sure can help communities across the country. Thank you.
That is excellent.
Great presentation as
Planning
usual.
councils.
Yeah, thanks, Stephen. And Vanessa, are y'all able to share our slide deck with the participants? I mean, if you
Yes, yeah, our
PDF
team
it, you know,
Yeah.
that. So
At the
there's,
end, Heather usually sends everything out. So that's,
Okay.
it'll be going to everybody that's on this webinar.
yeah, I mean, I think there's language in there to Stephen's point that can be pulled. But Stephen, I'm also happy to, have a call with you to brainstorm.
Thank you. And thank you for bringing that
Good to
up.
hear that. Thank you.
Thanks. Ronald, are you still with us? I see your hands up. Yes.
Thank you. Hi, thank you, Vanessa, and hi, Terry. Hi, Aaron. And as an aside, Aaron, I love your Chambers Street subway sign. As a native New Yorker,
Thank
that
you.
was one of my stops when going to work. My
Awesome.
question, beside that bit of trivia, in terms of raising the age limit for HIV testing, in one sense, and I think among all of us, it's a no-brainer, but going through the prevention task force, what kind of data are we going to have to present to get this age limit changed?
Yeah, that's a great question. So that's why I pulled the data from the website. But the other thing is during the during the NMAC Biomedical Prevention Conference that just was held in Las Vegas, I had dinner with Dr. Dimitri Daskalakis, who I know you all know that is the director of HIV prevention at the CDC, but is still deployed in DC for MPOX. He says he's going to be back by September. I'm really hoping. But during this conversation, even though we're friends, I have to talk about the CDC HIV testing guidance, and he knows that. One of the things that he said to me was, I think what's going to be your most powerful data, and we're going to have to put in a data request for the CDC, is, we can get the numbers pretty easily of, how many people 50 and older were diagnosed with HIV in a year. The story really is what I said earlier, what I'm most concerned about. The most powerful piece to prove our point is how many people that were diagnosed 50 and older were concurrently diagnosed with AIDS, because that tells the story. That tells the story of what we're scared of and why it's essential for us to make sure that older adults are not left out of this conversation. I mean, it is incredibly frustrating for me to be in these spaces and nobody is talking about prevention. And it's just, it's just something that we also need to make sure we're including in any of our policy agendas. So, Aaron and I are going to talk and we'll make a decision of how to frame that data request, because that really is going to be, what gets this to move probably is people are getting diagnosed with AIDS, which means they have advanced disease. And we know that you don't get an AIDS diagnosis if you were diagnosed with, if you acquired HIV yesterday, you've had it for a long time and it was untreated.
Ronald, do you have any other feedback to that response or a follow-up question?
No, not a follow-up. It's just the observation that it's, and I know why that the data is going to be needed, but it's just morbid, quote, to say the least, that we have to show people are already ill before we can get what to be a logical change to prevent that from happening. But that is the way this world is structured. So, but thank you for giving us that information, because it gives us what we need to look for.
I think that's excellent. And I want to add, before I make closing comments, I want to ask if any other people who are on the webinar with us want to ask a question or a comment.
Hi, this is Aline from Shreveport.
Hi.
Is there any way we could get a list of everyone's contact information and those email addresses that everybody's sharing in the chat? Because I'm trying to screenshot, but I can't screenshot it fast enough before it goes up. If we could get a list, a contact list.
But I'm gonna let Linda answer. I see that she's ready to
Yeah,
respond.
no problem. If it's been posted in the chat, we can collect that and send it out in tomorrow's email or whenever the email goes out with the slides and everything, only if it's been put into the chat.
Thank you so very much, Miss Linda. How you
Thank
doing?
you. So if everybody wants everyone to know who they are and how to
Oh,
reach
no,
you.
Vanessa, don't invite everybody to
Oh,
give
okay.
it.
Well, you said they only going to get it if they get it.
No,
Well, you
if
heard her. I won't repeat
you
it.
want to receive it, you're welcome to do that. But that, I don't want people to do it if they're not going to do anything with the information.
Okay, got you. We do have one announcement, but before we do, I just want to thank you both, Terry and Aaron, for coming and joining us this afternoon. It was a powerful presentation. It reminds us that our work is never done, but I think it's just a condition of being human, that we are going to have these challenges as we go along life, you know, the yin and the yang. And always, I just want to remind everyone, every day we fight for our rights, and it is tiring. It does get tiring. So I hope that folks are doing what they need to do to care for themselves, because we are way from over. I do see a light at the horizon, that this country, this global environment that we're living in, is moving towards realizing that we really have to treat everybody as human beings and respect them for who they are and where they are in their life. But I also realize that if we ever get there, we must be vigilant to stay there. That's what we sometimes don't get. Just because we get it doesn't mean it's always going to remain. It's like the Hershey's chocolate bar. You know, Hershey's chocolate bar goes away quickly if you don't take care of it. Oh, go ahead, Terry.
Thanks, Vanessa. And thanks again so much for having me and Aaron. You know, this is really important to us to have these conversations and be in community to think about these things. And, you know, I'm serious. Please reach out to me if anybody on the call wants to have conversations. I'm happy to set up calls. I mean, this is what I do every day, is think about this and want to be in service, but work with community. I don't want this just to be Terry speaking. You know, this has to be a collective. And hey, Steve Helmke, ACT UP friend.
Hello.
So, you know, I'm not kidding. Please email me if you'd love to brainstorm and chat together further.
Thank
Excellent.
you.
Go ahead, Aaron. You said thank you.
That's
thank
it. Just thank you. There you go.
Nice and simple and short. Thank you. I want to remind people that in the chat was posted a webinar on May 10th on HIV associated neurocognitive disorder and brain health. Please see the chat. The host has presented her name, I believe her. Please excuse me if you're not. And get in touch with her. All right, I'm going to turn this over to our Rock for Aging crew to see if there's any announcements they have or bid you a farewell. Shauna or Linda or Heather.
I'll just thank everybody for coming. This is really powerful information. I encourage you, as Vanessa said, you know, if you're not tired, please contact us, because there's a lot of work to be done. Just when I think I'm tired, it's like, oh my God, you don't have time to be tired. So if you want to be involved, if you want to add value to this space, many of our organizations and networks and CABs We're looking for folks to help us do this work and push it forward. So please, even when you come next month, bring someone with you so that they're informed and they have the tools to partner with you locally as we're doing this work. So again, thank you. Don't forget the evaluation. Again, Sage, Aaron, and Terry, we look forward as always hanging out with you guys. Thank you.
We do have
Bye,
a
everyone.
poll that Terry's put together if we want to launch that before ending. That's
Okay. Oh,
Oh, okay.
go ahead, Heather.
Alrighty, here we go. We're launching it.
So everyone, if you can take just a second, couple seconds and complete this poll. Terry's asking, number one is the LGBTQ plus and HIV long-term care Bill of Rights has passed in New York and New Jersey. True or false? Oh, these are easy, two easy ones. The Older American Act requires aging providers to collect data in responses to the needs of older adults with HIV. Come on, you guys know these answers. They just gave them to you. This was an open book test. Great, great.
I'm gonna give a few more seconds for folks to put in the answers and then I'll share the results with you all.
Thank you. And there are a couple people putting theirs in the chat. They can't access the poll. So thank you for your participation, Stephen, and anyone else that goes into the chat. Great. A lot of people responding. Thank you very much. Still coming through.
My apologies for putting it in the chat. I didn't see a poll come up, so I thought we just had to put them there. Sorry about that.
Bye, Jeff Berry. Thank
If you're
you.
finished, you can leave.
Yeah, if you're finished, we're 1 minute over. If you finish again, thank you. We greatly appreciate you.
I'm gonna
Yeah,
go ahead
great
and,
presentation.
I'm gonna go ahead and end this poll and share the results with everyone.
Okay. Great. Thank you, everyone. We greatly appreciate you.
So I should probably say what the answers are.
Yeah.
Just so people know. So the first one is actually false.
Yes.
New Jersey passed. They were the last state to pass, but New York is in the process of passing. So we haven't passed our legislation yet. So that is false. And then number two is also false. So the Older Americans Act, the legislation does not require to collect or respond to the needs of older adults with HIV. So as Aaron said, ACL sent out a guidance. So it was like a suggestion for folks to collect data and respond to the needs of older adults with HIV.
And that's why it's important for us to be doing this work, even at your local and state levels, to make sure folks know that that language is not there. There's over 200,000 of us and that language is not there.
Great. And so then number three is actually true, which is a little unfair because I actually didn't share that with you. So I'm gonna give everybody, I'm going to give you points on that, whether you said true or false, because it wasn't really fair because I only talked about 17% of people 50 and older in 2020. So I'm going to give you that one anyway, because I wasn't a very good teacher when I created that third one. So anyway, you got a freebie.
I didn't even hear the third question.
Thank you, everyone. Have a great day. Again, thank you, Sage. We greatly appreciate your commitment and support of the initiatives.